Hi, folks. My name is Greg Turner, the radiology coach. My job is to demystify the enigmatic world of X-rays. Medical students cover an enormous amount of information while in school, with the various topics and specialties to consider during one's tenure in the program. Trying to retain all of the information can be daunting. Students must simply focus on the current topic, invest themselves for a time, and move on to the next subject. Some course items are repeated and reinforced throughout the program, while others may serve as a one-and-done topic. One of those areas is often the field of radiology. In all fairness, learning how to read X-rays is a common theme throughout the program, but mastering X-ray principles, well, not so much. Here are 5 things about X-ray they don't teach in medical school. Number 1, how to purchase an X-ray system. It's one thing to interpret images that have been provided on a hospital monitor, but when doctors set out on their own, they may be faced with the daunting task of figuring out which system works best for their practice. There is so much to consider during this phase that it is not prudent to go at it alone. The radiology coach provides services and publications to assist you in seamlessly making these decisions. Number 2, caring for an X-ray system. Like most equipment, X-ray systems need to be monitored and tended to by an X-ray professional who knows how to provide periodic maintenance procedures so that the equipment will last to its expected duration. Partnering with a local X-ray reseller or dealer is the best strategy to achieve this. Number 3, managing X-ray files and data. Physicians must keep their patient X-ray files for a minimum of 7 years. If these include hard copy films, they must be stored in a safe facility that meets fire codes. If they are digital X-rays, they should be stored both on-site and off-site. In other words, redundant copies must be created and programmed to regularly back up the original film hard drive. These off-site storage servers or PCs must be located in a commercial office and meet standard fire codes. Additionally, doctors must be careful to only allow IT personnel with medical imaging experience to manage their imaging data. One of the main reasons is that the files are layered and encrypted, so when inexperienced IT specialists attempt to treat these files like all other files, there is a remote chance that the files will either be corrupted or rendered as unobtainable. Creating an X-ray workflow. So this principle does not involve patient trafficking, but rather where to acquire the data, where to save the data, and where to review the data. Once the X-rays are acquired on a digital system, then doctors and practice managers are tasked to make decisions on where the X-ray database should reside, on the X-ray computer, or on a local server, or on a remote server. This decision is predicated on how and where the doctors then want to review the images. Do they want to review the X-rays in their office, or in the patient room, or in the X-ray room? What if they want to review the X-rays from home? What must be done to achieve this? Additionally, some doctors will want to connect their X-rays to their office EMR or vice versa. They may wish to submit X-rays to the referring doctor or the radiologist for an overread. Patients may want X-rays in the form of a CD or flash drive. And what if the doctor wants the images to be provided in the operating room? All of these questions need to be preferably addressed at the point of purchase. Doctors can refer back to their dealer or contact the radiology coach for assistance. Number 5, administering general X-rays. Now, some physicians may balk at this as their programs provide some detailed X-ray acquisition studies. Podiatrists, chiropractors, DOs, and veterinarians all have extensive training and usually possess the skill sets necessary to provide this service themselves within their practices. But in most medical schools, the programs are not targeted to instructing student doctors in the mastery of administering X-rays. They simply know what they want to see on the X-ray image. Learning how to position the patient and administer X-rays is not critical to a physician's job, but if they take the time to grasp a basic understanding, it will only enhance the ability to effectively communicate with their staff when improvements are necessary. They will enjoy the conveniences of effectively communicating using the same syntax understood by their specialized staff. That concludes this segment on 5 things about X-rays they don't teach in medical school. If you like this presentation, please select the subscribe button below this video. You can also tap the bell next to it so that we'll notify you when other great videos have posted. My name is Greg Turner, and I'm the Radiology Coach. And remember, mark my word and mark your films.